Hi, Natus. Good morning. My name's Westley Davidson. I'm the Chief Project Officer for this beautiful Cowichan District Hospital Replacement Project. I'd like to thank you all for taking the time out of your day to hear how we've been evolving this new hospital over the past 6 months. It's hard to believe it's been 6 months since our last update. I feel very blessed as an uninvited guest to be on these lands, especially this time of year when the rivers are now full again once again. With water, the eagles and ravens are squabbling over the remnants of the salmon run. You know, the air is crisp. The sun hangs low in the sky, and we are getting ready for winter. We, the project, and Island Health would like to humbly and respectfully acknowledge the Cowichan tribes on whose unceded traditional territory, ancestral lands, the hospital is being built, recognizing their stewardship and protection of these lands since time immemorial. We'd also like to acknowledge that we, Island Health, serve the Métis Nation, Inuit, Dididat, Pachidat, Sabatsik, Stamanis, Penelakut, Layaxon, Halalt, Malahat, and the House of Friendship. Just a few housekeeping rules to start with. Slido is now closed, and any additional questions you may have for us today will be managed through the Q&A icon you can see at the top of your screen. We will go through those at the end of the presentation. We've left some time for questions, and the team will be working on those as we go through. It is my great pleasure to introduce Stuart Pagaduan today. Stuart has been a teacher within the community for many years, has been on the Cowichan Tribe's Chief and Council as a councillor, and is a master artist. Stuart has been engaged with the hospital project on and off for many years and has very graciously accepted a role within the team, and we look forward to him sharing his knowledge and teachings with us as we move along on this journey. Stuart is going to provide us with a traditional welcome and start us off in a good way. So over to you, Stuart. Thank you.
Thank you, Wesley. I need that Siam Sol Plan. I Chapka Kochi Altmistol Katananitas. Meet no Elam Chap, the Simdana Cowichan Tomo. Good morning, my dear friends and relatives, and just keeping in line with our protocol of our elders of the past and present, we formally welcome you today. And they would tell you they're happy to see you, and they would like to wish you well in your walk today. So welcome, everybody. Haichka.
Haichka. Thank you, Stuart. Anna, would you mind putting the presentation back up, please? Thank you. Next slide. Thanks. So my initial role is just going to be a project overview and then MC the questions. So just as a refresher for everyone, these are some quick facts. We're building a 204-bed hospital at Balmakinnon. It's $1.45 billion. If you say that quickly, it doesn't sound as bad. We're trying to build the most culturally safe and welcoming space we can. It's fully electric. There are 800 free parking stalls, and they will have free Wi-Fi throughout the facility. Next slide, please, Anna. So in terms of our journey, for those of you who have been following along, we started our business case planning and approvals in 2020, procurement in 2021, and then we started the excavation construction in 2023. So the team's been going for a number of years. We're now well into construction. We had a topping off ceremony earlier in this year for the D&T building, and we're looking to top off the IPU early in the new year. We're right now into the operational readiness phase, whereby we're starting to look at what we'll need to develop as a structure and a strategy to ensure we have fulsome operational readiness as we start to move patients in. And just a reminder, we're anticipating construction will complete towards the end of 2026, and our first patient day will be in Q2 of 2027. Next slide, please, Anna. So our Indigenous Relations Team continues with engagement, including recent All Nations gathering, several Chief and Council engagements, and additionally, the team are focused on engagement around language, art, and traditional foods. Later on, you'll hear about our art program from Kathryn Gagnon. As we segue into operational readiness, some of that team's focus will shift into process and procedures, developing those to support the new facility when it opens. And now I'll hand it over to Sean Quimby, our Alliance Project Manager from Alliston, who will take us through the construction.
So yeah, my name is Sean Quimby. I am the Alliance Project Manager. I'm also a construction manager with Alliston Construction. As Wesley mentioned, we started construction in October of 2022. Substantial completion is 2026. So in a 50-month schedule, we're about just over half, so 24 months left to go. Following construction, there will be the 6 months of wrapping up commissioning as well as finalizing operational readiness. And as Wesley said, first patient is in the spring of 27. Some cool facts about construction that I find interesting, maybe not that everyone does. We have poured 32,000 cubic meters of concrete. We even had the longest single concrete pour on the island in 35 years. We poured 2,400 cubic meters that was spread across 3 concrete plants, and it took a little over 14 hours. From my colleague Greg will talk about the labor a bit more, but I just wanted to highlight that we currently have roughly 600 workers on site on a daily basis, and into next year we're going to be peaking at around 800 workers daily. What that equates to in hours is about 1.5 million hours of skilled labor next year. This slide here gives a good view of the overall site. So this is looking from the west facing east. On the right hand side, just in front of the red tower crane, we have our inpatient tower. We just actually finished our concrete there, so we're focusing on the structural steel to the mechanical penthouse, and with the heliport coming in early next year. On the left-hand side, the shorter building, the more rectangular building, is our diagnostic and imaging building. The focus of activities there right now is getting the building closed in, working on the building envelope, including the cladding and the roofing, along with the interior work with mechanical and electrical roughing taking place right now. We've framed the majority of the walls, and we're just actually starting to close up walls with drywall in the level 0. Next slide. The inpatient tower and diagnostics treatment building is connected by the 2-story lobby or community hall that has entrances at both the east and west side. This area, we're using mass timber as one of the main structural elements. The install is being performed by a local contractor, Kinsall, who started on site in September of this year and will continue install into January and February of 2025. The timber is also being used in the reach out building to the west of the IPU tower, the conference center adjacent to the east entrance, and as the exterior canopy of the emergency department. You can really see how these images are starting to take shape to align with the rendering that's actually in my background here. Next slide. This image shows how the mass timber will be used at the west entrance to support the glazing, which will be installed in 2025. With the image being taken from inside the lobby, you can also see how the mass timber extends from the interior to the exterior and acts as the canopy above the west main entrance. Next slide. With a large focus on getting the building closed in right now, this image highlights the cladding, the slate paneling, and glazing being used at the ambulatory care building west of the diagnostic and imaging building. Although you can't see it in this image, you'd likely see it in some of the other renderings. There will be a public patio on the roof of this building just outside the dining room within the food service area. This patio will have a fantastic view of Mount Swakis. Next slide. The image on the right is of the ongoing steel stud framing to the triage and registration area just inside the entrance of the emergency department. And the left image shows the interior framing to a typical inpatient room. This picture also shows the size of all the inpatient room windows. So they'll all be that size. And with that, I would like to pass things over to my colleague, Dr. Pat Gallagher, to provide an update on the clinical.
Thank you, Sean. Next slide, please. I'm Pat Gallagher. I'm the medical director with CDHRP. So just in previous sessions, we've sort of reviewed a lot of the big items in medical imaging, ORs, etc. So today I'd just like to talk a bit about ambulatory daycare and day programs. This is a bit confusing to current CDH users because ambulatory care equates to surgical care. Those services will all be in the perioperative program. This is the building that Sean just showed to the west of Emerge, and it's outpatient programs. We'll have 4 clinics. The 2 northerly clinics will be visiting specialists, perhaps rapid access for heart health or things like that, perhaps an MS clinic. So those clinics will be itinerant. They will be set up for the day and taken down the same day, and the next occupant come in the following day. To the south of that is the CON clinic, the Community Oncology Network, where cancer care will occur. This will be 10 spaces for treatment, and they will also have a dedicated area for offices for the oncologists, social workers, and also a satellite pharmacy associated with them for the chemotherapy. And finally, in that area to the south will be a medical daycare for infusions, IV, blood transfusions, iron transfusion, medication infusions, and minor procedures such as paracentesis, thoracentesis. You'll notice on this slide, one of the questions asked was about will there be a cardiac catheterization service at the new CDH? And the answer is no. Currently on Vancouver Island, the only such service is at World Jubilee and will not be relocated to this building. Next slide, please. This is a slide on the left side to highlight the large space that UBC will have in our facility. There will be meeting rooms for UBC. There'll also be 2 simulation labs, which will also be accessible to staff, and facilities for the students and residents. We've always had, or for quite a few years have had, the 3rd-year clinical clerks in our building year-round, as well as occasionally the 2-year family practice Indigenous Residency Program. We now have 4 family practice residents from UBC in our building, and we'll be adding another 4 next July. And hopefully at the end of their training, we will have some of them remain with us as family physicians in the Valley. On the right of this slide is another area that is new to CDH, which is the Psychiatric Emergency Zone, which is attached to the emergency department. And this clinical team that you see here are standing within the lounge area with the back behind them being the collaboration center. Next slide, please. The treatment room here is actually just one of 2 that will look like this. There'll be private spaces for things such as I mentioned before, thoracentesis, paracentesis. The other 8 treatment spaces in the Con Clinic will be treatment bays that can be made private with silencia screens, but also have the capability of being open so that people can chat with their neighbors. And that is the right side shows that the beginning of one of these bays being built. You can see the large windows in those spaces as well. Next slide, please. One of the big jobs that the clinical team is doing right now is doing a compliance check of the building. In the Alliance methodology that we're using to build this building, we do not have compliance architects. And along with Parkin, our design architect, Island Health has the staff that you see here wandering the building routinely, trying to ensure that what is being built is what we designed, that we adhere to infection prevention control standards during the building, and that all the devices are set up in the right place, so as people try to hit automated door openers, that they're in the right location. Next slide, please. We're also working with Cygnus, a consulting firm, to do our wayfinding and signage. Cygnus is currently doing this work with NRGH, initially just for their new ICU, HAU, but also now for the whole building. And they are working to make sure that as people approach this building from the highway, that the signage is intuitive and informative and takes them into the appropriate parking lot, then into the building, and then once in the building to their ultimate destination. And hopefully this will be accessible for all that come. We show one person here in a wheelchair, but we're also paying attention to those with low vision and other disabilities. And next slide, please. So I'd like now to pass on to Corry Pettigrew, who is our Clinical and Support Services Lead.
Thank you. Operational readiness is a phase of the new hospital project that is focused on ensuring the new facility and the people who work within it are ready to open and operate safely, efficiently, and on time. It involves detailed planning and coordinating activities to prepare the facility, staff, and our equipment for a successful transition to the new hospital. It's a large undertaking, and we are aware that we are not the only ones doing this work. We are working with other new hospital builds across BC to share learnings. Next slide, please. The Operational Readiness Project has been broken down into the following work streams that you see here. These work streams are individually responsible for developing work plans, identifying key milestones and deadlines to contribute to the overall schedule, and identifying resources needed to complete the work. Some examples of this include comprehensive staff education and training for new equipment and processes. This includes everything from general orientations to running patient simulations with staff based off of their new workflows that need to be developed. We also need to test each and every device, piece of technology to ensure that they are coordinated and working as they should, and ensuring that all programs and departments have the licensing, accreditation, and regulatory requirements for operations. Collectively, they work together with the operations team to ensure that goals and objectives are met so that the hospital can safely open and that staff are prepared and can go from treating patients and operating in one hospital to the new one. Next slide, please. These next few slides will highlight the various phases of this project, each one of which has been or will be done in collaboration with both the operations team, those working in the hospital, as well as patient partners and different members of the community with various abilities and perspectives to ensure that these spaces will work for everyone, whether you're providing or receiving care or visiting someone needing care. The goal all along has been that this hospital would be based on evidence. To that end, throughout design, our team did the research. We worked with subject matter experts and those with experience in the various areas and designed it with best practice in mind, thinking of future workflows throughout. As part of this process, we went through a mock-up process, which resulted in some fully built mock-up rooms one of which you can see here, which allowed our care teams to come in and confirm that the space they designed works the way it should. Next slide, please. And here you can see that same inpatient room as it's being constructed. This is when that regular monitoring, the compliance walks that Dr. Gallagher was just discussing, are occurring to ensure that the spaces are built as they are designed. Throughout construction, operational readiness planning is happening simultaneously. Next slide, please. As we reach substantial completion in the fall of 2026, systems integral to the facility will be tested. And this occurs during that building handover. Next slide. The building is then fit out with equipment, furniture, and all the bits and pieces that are required for everyday function. It's through this phase that the operational readiness team can come in with the staff and medical care providers to start orientation and training within the new facility. Next slide. That orientation is crucial so that everyone is prepared on the first patient day when they transition from providing care in the old facility to the new one. This rendering shows what the final patient room should look like, including these large windows that will provide natural light and views that have been proven to improve patient outcomes. Next slide. With the new hospital on the horizon and patients to care for in the current CDH, our HR team has been working proactively to recruit healthcare staff. They recently completed a highly successful recruitment campaign and are gearing up for another. We are focused primarily on hiring nurses, RNs, and LPNs, but we are also hiring pediatricians, psychiatrists, hospitalists, emergency physicians, nurse practitioners, physiotherapists, and pharmacy technicians. Please let friends and family know that we are hiring and share with those who'd like to join our wonderful team of healthcare professionals. Our staff tells us there's something special about the healthcare community in Cowichan, and we couldn't agree more. And next, I'd like to pass this over to Jennifer Sirup, the program coordinator for the Cowichan Health and Care Plan.
Thank you, Corry. Good morning, everybody. The Cowichan Health and Care Plan was created as a sister project to the new hospital build. The underlying goal of the project is to demonstrate that strategies investment in community services can contribute to optimal census and patient flow in acute care. The additional resources we are investing through the Health and Care Plan are allowing us to provide care in the community to some of the larger client groups that historically have used the hospital frequently. This is enabling the people to be healthier at home, and as a result is reducing the need for acute care visits. The target for the Health and Care Plan is to create 21 beds per day in acute care avoidance by the time the hospital opens in 2027, and 44 beds a day to meet the demand for care in 2035. Next slide. Since 2021, the Cowichan Health and Care Plan has received funding from Island Health to support key client diagnosis groups at CDH. Initiatives to support people in these client groups include expansion of palliative services, including the redesign and expansion of hospice, expansion of our transitional care unit, support for COPD clients, additional support for advanced frailty assessment, and our hospital at home program. Implementation of coordination positions such as the hospice clinical nurse leader, community connections clinicians in the emergency department, and the IV coordinators have improved transition of care and patient flow from CDH to community resources. This year, we launched a Falls Awareness campaign with the next steps to include identifying further opportunities to support people to remain healthy in community. Next slide. Hospital at Home is a new service that has been started at CDH and is based off of the service piloted in Victoria. The service offers an alternative to people needing acute care services who meet specific stability and safety criteria, where they can continue their acute care journey at home with the Hospital at Home team providing service in a home care style. This service is approved by the Ministry of Health to run at a census of 10 patients. The service is able to reduce the number of people within the brick and mortar of CDH while still providing the necessary care for these patients. When the patient's acute care is complete, the patient is discharged from the service just as they would be if they were in a hospital bed on site. At this point, the patient can be referred on to community services for any ongoing support required. This program was launched in mid-April of this year and has cared for over 50 patients in the community. The team consists of an interdisciplinary team of caregivers. The variety of services available include IV therapy, medications, blood work, wound care, and monitoring. To date, we have received a great deal of positive feedback from patients using the service, as they do appreciate the ability to be in the comfort of their own home while still receiving a level of care that otherwise isn't available through community services. Next slide. Since the inception of the Cowichan Health and Care Plan back in 2021, we are thrilled to acknowledge some of our results, including a current bed day savings of 19 beds a day. Initial health and care plan client groups are now showing significant reduction in admission rates. 2 years of sustained undercapacity at CDH despite population growth. A 25% reduction in COPD admissions since 2020. 99% of palliative end-of-life clients supported by community health services teams are experiencing death in community versus acute care. Our STEPS program has expanded twice to meet demand. The ALC rates have been reduced by 70% since 2020. 53% reduction in dementia-related admissions because of our STEPS, Seniors Outpatient Clinic, increased adult day programs, the Hamlets, and an increase in home support. Community inreach to the emergency department and connecting clients to community services to prevent representation to CDH. And the Seniors Outpatient Clinic has assessed over 770 clients to date. We are currently awaiting for approvals to move forward with our next bucket of work while we maintain all of these results on our current services. And now I'd like to introduce to you Kathryn Gagnon, who is the lead art curator, and Shane Czypyha, the principal architect from Parkin Architects, for an introduction to the Art at CDH program.
Thank you, Jennifer. Good morning, everyone. In engagement sessions with Indigenous community members to determine how to make the hospital environment more culturally safe and create a welcoming environment, it emerged that the installation of art would not only create a sense of safety and comfort, but would also be a way to engage in storytelling. Indigenous art embodies stories and the history of the land and everything in it. The presence of Indigenous art, it was learned, would foster a sense of comfort and familiarity. The creation of comfort and familiarity, where people see the beauty and culture of the Cowichan Valley in the hospital spaces through art, is something that all people who are in the hospital can experience. While Indigenous art, language, and culture are being foregrounded in the hospital's new art collection, it will be informed by all the communities served by CDH. Art will be representative of all people and communities. To that end, Island Health is pleased to be developing an art program for the future hospital. Next slide, please. The installation of art in a hospital environment can serve more than an aesthetic purpose. Art promotes healing and enhances the quality of healthcare experiences. Evidence-based literature shows that integrating art into the construction of hospitals can reduce stress and lead to improved health outcomes for patients. For example, art has been shown to decrease the need for certain medications, shorten hospital stays, and it cultivates a calming environment. Art can provide a positive distraction during some of the most stressful times of our lives. These are images from the Tech Acute Care Centre at BC Children's Hospital, including the operating theatre filled with whimsical imagery. In the atrium, in the image on the left, there is a sculpture called Flight of the Doves by Marie Corry. Mansura kindly permitted us to share the comment she posted on the artist Instagram feed. She wrote, "We sat under these doves during my nephew's 11-hour surgery. We cried, laughed, and looked up to the doves and cheered for life." Next slide, please. Engagement with communities and artists is ongoing. The input that we receive from journey mapping sessions, community consultations, and the Indigenous Advisory Council helps to guide decisions about artwork and how it will best serve people in who use the hospital. Art is being procured through commission, acquisition, and donations. We invited local and island-wide artists to attend an open house shown in the on-screen images to learn about art opportunities in the new hospital. Members of our Alliance team representing wayfinding and interiors, Indigenous art and mentoring, clinical and infection prevention and control, exteriors and landscaping met with about 250 artists during the event on November 1st. There was a tremendous support for the new art program. Upcoming engagement events include one dedicated to Indigenous artists, which will be scheduled for February 2025. A CDH staff engagement event celebrating the numerous talented artists in the healthcare community. We're also planning an artist engagement event at the Paldi Temple for summer 2025. We're developing a school art program working with School District 79 and the Cowichan Valley Arts Council to pair students and teachers with artists to create public art installations for the new hospital. The goal is to ensure that the art that is displayed is representative of all people and communities of the Cowichan Valley. And over to you, Shane.
Thank you, Kathryn. Good morning, everyone. So Kathryn already touched on the effect of art in healthcare outcomes. In addition to that, biophilic design encompasses the relationship between the built environment and our human need to connect with nature and living things. And this connection can be absolutely instrumental in healing. Our design helps to bring this nature into the hospital to create a calming environment for all of patients, staff, and visitors. And we do this with the integration of mass timber in several spaces, which you already saw in some of the terrific construction photography, as well as using images of nature in art and wayfinding and prioritizing views to nature. Next slide, please. It's important that art, and specifically Indigenous art, is prioritized, and in several cases it's intentionally embedded into key areas of the building's design. So Indigenous art is foregrounded as a response to recommendation 10 from the In Plain Sight report, and it's a response to the historic racism that's been experienced by Indigenous communities in Canada's healthcare facilities. Art and design can support an environment of cultural safety, and it's absolutely important that Indigenous voices are essential for the integration and interpretation of art. I'm going to share this quote from Paula Norris, an Indigenous advisor on our team. Art is vital to our Indigenous families. It's part of our storytelling through a variety of art forms, from house posts to petroglyphs, painted houses to wool and cedar weavings. We are sharing the history of our peoples. Next slide, please. The design of the building focuses on connections to the landscape through views to nature, designed landscape spaces that are inspired by the locale, and an inside-outside connection to these spaces. The building and site are designed to frame and focus on the landscape, such as mature trees on the site or views to significant features like Swakis and Zuhalem and the lakes and the islands of the Salish Sea beyond. The landscape design itself provides many opportunities for art locations that can speak about the land, its history, and the history of the people who've inhabited it for over millennia. Next slide, please. And our interior design scheme is also grounded in the Cowichan Valley itself. The concept for the interiors is inspired by the stalo, the rivers and other waterways that take you on a journey through the land. We've learned that there's a deep, abiding relationship with the Cowichan River, which winds its way through the forests and out to sea. And through the tributaries, creeks, lakes, these waterways connect communities and people and provide them with sustenance and life. The Weir teaching reminds us that the actions we take today will impact what happens downstream. And this concept reinforces the message of convergence and the connections we have with nature, our communities, our heritage, and where we are headed today. I'll hand it back to Kathryn now.
Thanks, Shane. The Arts Advisory Council will begin to send out calls to artists for specific kinds of art through our website. This month, we will be reaching out to nature photographers. Images of nature have been shown to reduce stress and create a calming environment. Art promotes healing and enhances the quality of healthcare experiences. It benefits all, patients, families, healthcare providers, volunteers, and visitors by supporting physical, mental, and emotional wellness. Art will play an integral role in creating a comforting and welcoming environment in the new Cowichan District Hospital and be a lasting legacy for the Cowichan community. And I will hand it over to Greg Johnson, Executive Director, Stakeholder and Community Relations, BCIB.
Thank you very much, Kathryn. And thanks, Shane. I want to talk a bit more about construction and who is building your new hospital. So the skilled construction trades workers who are actually building this new amazing facility from the ground up. These are your neighbors, maybe their family, your loved ones. These are the people who live in Duncan, North Cowichan, the Valley, and across the South Island. And these are the people who are going to use this hospital when it's ready. And so this is a picture of Karen Parkinson, and she is one of the local workers that was a carpenter on this project. And she's one of about more than 600 people that are currently working on the project today. Over the next slide, please. So I'm with an organization called BC Infrastructure Benefits, and we're part of the Alliance. And what we do on the Alliance is we're the employer for the skilled trades workers on the hospital. It's our role to make sure that there are community benefits from this project right now, even before the first patient is admitted. We make sure that all the skilled trades workers who are building the hospital get good union wages, benefits. There's careers and opportunities for advancement in those careers. There's apprenticeship opportunities and respectful job sites where people actually want to go to work. So right now, with about more than 600 people on the project, that's a big project. It's a lot, and we're still hiring more people. As Sean Quimby said earlier on, I think we're going up to about 800 or more people. What's really impressive about the size there is that about 85% or more of those workers are local. And that's really impressive for a project of the size, because when they live in the community, that means they're spending their wages in the community at coffee shops, restaurants, gas stations. So it makes it a social and economic benefit for the community. So we use something called priority hiring. What that means is that we look for opportunities to bring new folks into the construction industry. In particular, that means Indigenous peoples. It means women, folks who may be underrepresented in the construction trade, but it also means locals. And we're really proud that of the workers on this project, we have more than the provincial industry average for Indigenous peoples and women on the tools. One of the ways to help keep workers on the job site is making sure that it's a safe and respectful job site. So we provide training for all workers. We call it the Respectful On-Site Initiative, and it's really about teaching the history of the Indigenous peoples across Canada, in particular in the Cowichan Valley, as told by Cowichan knowledge sharers. A lot of people, when they're working on a project, they're going to find they're working with people who may not look like them. And with this training, we find it helps people become more collaborative and creates a sense of community, creates a safer, more respectful job site for everyone. That means more people are likely to stay and continue to work and build their careers here on this hospital in their backyard. Next slide, please. We are still hiring skilled trades workers, and people can apply on our website. On there, you'll see that we'll describe the certifications and the qualifications we're hiring. And in demand right now, we're looking for more electrical workers, plumbers, and pipe fitters, and sheet metal workers. And if you're a trades worker, but not in these particular trades, we still encourage you to apply. We'll keep you in our database, and if your trade is in demand, that's when we'll give you a call. So if you know someone who wants to work on this project, even if they're not local, get them to apply anyway. Go to our website at bcib.ca. There's still a lot of construction to be done. So thanks, everyone. I'm now going to pass it over to Naomi Lowe at the Cowichan District Hospital Foundation.
Thanks so much. Again, I'm Naomi Lowe. I'm the Executive Director here at the Cowichan District Hospital Foundation. I appreciate everyone taking the time to come out and hear the information today. We're celebrating our 40th anniversary of serving our community this year, a big milestone for our hospital foundation. And traditionally, we've raised funds for equipment for the Cowichan District Hospital, as well as Cairnsmore Place, which is our long-term care facility. And we undertook with this new hospital project a huge fundraising campaign. We're trying to raise up to $20 million to help support this campaign and support the new hospital project. And with that, we're utilizing our traditional means of raising funds through our gala and our golf tournament. But we have a unique opportunity right now too to be able to offer naming opportunities within the hospital space for individuals and for businesses that would like to leave a legacy. It's pretty incredible and pretty inspiring, and we want to thank everyone that's reached out to us. We do have the blueprints and we have information on the spaces if anyone's interested. And also, I guess one of the things that I wanted to mention as well is we're coming into the year end, and for a lot of our donors that have been reaching out, we're ever so grateful. We know that the postal strike has affected many people, but one of the ways I know there's a lot of people reaching out, they want to donate before year end. So we wanted to mention that if you call us or you can donate online, or you can pop into our office, which is at 7233 Trans-Canada Highway. Come in and have a coffee and talk about the new hospital project. We'd be happy to host you guys. So thanks for giving us this opportunity to speak, and we look forward to hearing from you.
Thank you, Naomi, and thanks to all our speakers today. I hope you found it informative, and it's time for some questions. So once again, there's a Q&A button at the top of your screen. Hopefully, if you have a question, please put it in there, and we'll hopefully get to all of them. Anna, if you can stop sharing your screen, and if I can ask our team to turn their cameras on, and maybe you can start with the first question, if that's okay.
All right, thanks everybody. So our first question today comes from Slido. Will the parking for staff be 100% adequate, unlike other locations like RJH?
That's a great question. And I think the answer to that is we've doubled the parking from what is at the existing site to the new site. So we anticipate that will be sufficient parking to support us in the near to distant future. Should we need additional parking in, say, 40 years or so, we could put a park gate towards the back to provide additional parking. In addition to that, there are opportunities for public transport. So there is going to be a bus service that will stop directly outside the new hospital, as well as the Balmakinna local area plan supports both walking and cycling opportunities to the new hospital.
Great. So next question came by Teams. Holy moly, amazing stats from STEPS. Is there a plan to build some rehab, SLP, OT, PT, and RD into the program?
That's a great question. Donna, are you able to provide us some advice on that?
I sure can. Thanks, Wesley. So one of the things that we've done very purposefully in Health and Care Plan is build our new initiatives in an integrated way. So our STEPS is connected to our community health services team. And so if our clients are needing those types of services, they have access to that through our community services team. And if there's anything specific that would require them to be getting services out of CDH outpatient services, we do work with that team as well to make sure that the clients at STEPS are getting what they need. So we have the access to those services already in place, and there is no plan to add them specifically into the STEPS team. So hope that answers the question. Thanks.
Super, thank you. Thanks for that, Donna. Anna, the next question.
Yes, we have a great question from Slido. How are the IPAC, the infection protection and control requirements, met while using wood throughout the new hospital?
I don't know if Janine, you'd like to take that, and maybe Corry. Start with Janine then.
Sure, thank you. I'm Janine Kidd. I'm the clinical project director for the design construction part of the project and the lead co-lead for the operational readiness side. So I'm just going to answer this question in 3 phases. So the part around design. So there was a lot of review of clinical and non-clinical spaces in order to determine where mass timber and wood could be used within the hospital spaces, with a priority towards non-clinical spaces. And so you'll find that there are areas in the hospital that do have wood and areas that don't. Now that we're in the construction phase of the building, we're now monitoring any mass timber and wood structures within the building to ensure that during the construction phase, their integrity is maintained, so that we know that they are in the best condition they can be in as the building gets closed up and we get ready to open the new building. The other way that we then explored and discussed the use of the wood in the space was from what happens when we move into the operations of the building and we start using the building for clinical and patient purposes. And some of the ways that we looked at that was to look at the sealants and the surfaces that are covering the wood to protect it, and balancing out the maintenance of those surfaces with the cleaning requirements to ensure that we're optimizing the length and duration and of the cleaning the surface over time, and minimizing the maintenance of those surfaces over time. So and then one of the other tricks of the trade is to lift the wood up off of the floor so that it is easier to clean the floors around it, and we minimize the damage to the wood. So our IPAC team, both the leads in the project, Elliston, and our partners, as well as our operational IPAC team, have been involved in depth in reviewing and determining how best to manage this wood within the building. And they have recently gone to a national conference to speak about what we've learned and the approaches and safety features of this on the go forward.
Superb. Thank you, Janine. Do we have any other questions, Anna?
Yeah, we've got a few more. So this came by way of email to newcdh@islandhealth.ca. Are plans underway to include a $10 a day childcare on site or in close proximity to the new hospital? Who is coordinating, breaking down barriers, and ensuring this necessary facility and service? It is necessary because all level of staffing will be desperate for quality childcare and early learning services.
Thank you, Anna. So at this time, there are no childcare spaces on the existing site or within the existing facility. We are aware of this growing concern. You know, the hospital can't survive in isolation out in Balmakinnon. It's the reason that it's there is as part of the Balmakinnon local area plan, and in conjunction with the municipality and some developers in and around that area, we have had discussions about childcare spaces in and around the hospital. So that will include opportunities for staff and community members to potentially have childcare spaces near the hospital. There will also be opportunities for pharmacies, gyms, cafes, and housing. That's part of the Balmakinnon local area plan. Our Island Health Workforce Strategy team is also working to support dedicated childcare spaces for Island Health staff and medical staff.
Great. Heading back to the Teams chat, we have parking at the current hospital is free and no difficulty finding a spot. Parking at Victoria General is not free and it's very difficult to find a spot during the day. Will there be lots of parking and will it be free?
So yes, the parking will be free, and there are twice as many stalls in the new hospital as the old. So if it's easy to find a parking space in the old, then it should be easy to find a parking space in the new. Any other questions? Okay.
Yeah, we have one more for now. It's a great note. I am a pharmacy technician in Toronto, Ontario, and would like to work at the hospital.
Okay, excellent. We'd love to hear from you. We have opportunities aplenty, I think, in terms of in terms of clinical staff needs. I don't know, Alice or Janine, would you like to just touch on that through operational readiness? Alice, maybe?
Sure. Alice Gelke. I'm leading operational readiness. And we, as Corry mentioned, we've already got a people readiness work stream underway and doing some recruitment for our existing site. I don't know specifically how we're doing with pharmacy on the existing site, but would encourage you to reach out, as Wesley said. We will be putting a fairly robust plan together to look into the future. We're going to need to increase our staffing and need to plan for that, and we'll be advertising as well. So just again, encourage you to reach out and see where we're at. Thanks.
Great, thank you, Alice. Anna, are there any other questions?
I believe we have one more coming. Just step back for a moment here. You can read it, Anna, if you like. It says, hi, any plans for a post-occupancy evolution within a year or so? Thanks.
Evolution.
Evaluation.
Maybe evaluation, is it? Hopefully. Yeah, so the evaluation will definitely take place. And Alice, maybe you can talk a little bit about that from an operational standpoint.
Will do, and maybe Janine can jump in as well if she has anything to add. So as again, Corry mentioned, we are very plugged into other activations that have occurred and learnings from those activations, and absolutely that post-stabilization period, if I'm interpreting your question right, is incredibly important as actually the move in. It's that stabilization period that we understand is minimally a 6 months process. So we are planning for that. We have a quality stream that will be looking very closely at what we need to look at for evaluation, identifying those metrics, including staff satisfaction, validating that the workflows we've developed and standard operating practices are working, et cetera, et cetera. So we, again, have dedicated staff planning and looking at that. We will involve our user groups as need be as well. And I'll just hand over to Janine to see if I've missed anything. Thank you.
No, but I'm just watching that maybe we are talking evolution versus evaluation. So maybe I'll just frame that as we move into the new site, we will be handing over the site to operations, and they will be looking at the capacity within the site and the demands around them to develop whatever that go forward is for the hospital after opening day. So our focus is in determining what opening day will look like, what are the services, the service model that we'll be opening with, and then supporting the transition to operations, and any future development is over to the operational team to prioritize and determine what comes next. So on the evolution side, that's how we would manage that on the go forward within the building. And on the evaluation, part of, as Alice has articulated, we'll be developing out more fully what that evaluation plan will look like, and it will include, there are construction and system operation components, as well as looking at the transition itself. How did that go? And then how are we functioning in the building itself?
Great, thank you both. Anna, I think we've got time for one more, perhaps.
All right. What are the backup systems for heat, light, and hot water in the case of electrical power disruptions?
Great question. I don't know, Sean, if you want to take that, or I can take a swing at it.
I can jump in there, and if you want to get more technical, feel free. The backup system is typically to be what would be if we weren't fully electrical hospital. There are generators that would kick in should there be any electrical disruptions.
Yeah, thanks. I think that's probably enough. I don't know. We need to go into too much more detail than that. So thanks, Sean. Any last questions before we conclude?
We do have one more. I'll just pull it up. Are there additional office spaces being built beyond the anticipated needs? There's so often a greater need than originally anticipated.
I can answer that. So at this time, we aren't building shelled space within the facility. We have opportunities for future expansion and overall design expansion into 2080, with the site being so large. But we're unable through our funding envelope to provide shelled space. So there will be essentially a finite amount of space that we'll have to manage as an operational team to best support the community. Okay, we've got one more comment. I think Anna, and then we will have to conclude.
All right. So thank you. So interesting, especially excited about the attention to detail and design with nature. Please share the link for the current photography call.
Kathryn, can you just answer that quickly, when the call goes out and where people can find it?
Yes, they'll be able to find it on the Art at CDH webpage, and that we're planning on putting that out in probably the next week or two before the holidays start.
Okay, thank you. Thanks, Kathryn. I saw there was one last question that came up. What are we doing with the old hospital site? Just to reiterate, this team is entirely focused on building the new site and operating it. We haven't taken our eye off that ball, and we are unlikely to do so for some time as we start working on operational readiness and really start rolling that out. So we understand there's interest in the community. There is a petition that has over 4,000 signatures on it, is what I understand from my discussions with the community members, but we are not quite ready to have a discussion around that. Island Health has no plans for the existing site at this date, and we have committed to having a discussion or hearing from the community at a time that that meets our timeline as we work through operational readiness. Unfortunately, we're close to time, so once again, I'd like to thank all of our speakers today. I'd like to thank everyone that has attended today's presentation. As Greg had mentioned, and we mentioned from a clinical standpoint, we are always interested in people that might be willing to enter into either the healthcare field or construction field. And please feel free to encourage your family members to either connect with BCIB or connect with a new CDH at islandhealth.ca if there's interest. Thank you for today, and have a good rest of your day.